The VOX Markets Podcast with Justin Waite. Nothing in this podcast is intended as investment advice, and the people in this podcast may hold positions in the stocks they talk about. Do not buy anything based solely on a tip or recommendation. Please do your own research.
And joining me on the podcast right now is Andrew Newland, founder and chief executive officer of Angle PLC. AGL is the ticker there. Andrew, thanks for joining me.
Good morning, Justin. Nice to join you.
Yeah, I've heard a bit about your company, but for people not familiar or new to the podcast, Andrew, can you just explain what Angle, the business, is all about, please?
Yes, of course. Our business is focused on cancer diagnostics. That means the detection of cancer and also driving treatment decisions to make sure that patients have the best possible outcome. And we've developed something called a liquid biopsy, which enables repeat biopsying of the cancer to personalised treatment.
I see. And could you explain, you talk in your recent news about the Parsortix system. How does that work? What is that? Explain that if you could.
Yeah, so Parsortix is our lead system, and it's a microfluidic system which is capable of separating cancer cells from blood. The reason that's important is because cancer spreads via the blood circulation system. So a patient might start with breast cancer, and then her disease would spread, and ultimately patients who die of cancer die of the spread of their cancer. At least over 90% of them die of metastasis, and that is where the cancer spreads from the original primary site. In my example, breast cancer, it will then spread to other locations such as the brain, the bone, the lungs, and the liver. It makes this transition from one location to another via cancer cells leaving the primary tumour, the breast, and travelling in the bloodstream. Now, these cancer cells are available in the blood, but there are very small numbers of them. So perhaps one cancer cell in 1,000 million blood cells. Now, the key here is that our microfluidic technology can separate those cancer cells from the blood cells, and that means that they can then be analysed. And the reason that's important is because it enables a repeat biopsy. Because if you think about it, every cancer patient, if they can access the tumour, they will have a tissue biopsy. That means cut a little bit of cancer out and investigate that to work out how to treat the patient. And the problem is that cancer changes over time, and there's a need to repeat the biopsy. But of course, you cannot go back and repeat the tissue biopsy, because by that time, the cancer's been cut out. The woman has had a mastectomy or a lumpectomy. So we're revolutionising the way that cancer is treated by enabling repeat biopsies to make sure patients can get the correct treatment at the right time.
Understood. And what indications are you currently working towards, and how far through the development curve are you with them?
Well, our technology, Parsortix, has got a very wide application, and leading cancer centres around the world have demonstrated that this system works with over 23 different cancer types. And in fact, so far, it's worked with every single cancer type that's been tried. Obviously, with that wide range of potential, as a mid-sized company, we have to be very careful and focused with our resources. So we're picking off individual disease conditions one by one, and the two lead conditions that we're focused on are breast cancer, where we're progressing a number of studies, and ovarian cancer. But in due course, we want to spread the application of the system to every cancer type.
Yeah. And what's next steps, next news, next milestones you're heading towards?
Well, the big areas of development that the company is working on are in breast cancer. We're seeking to get an FDA clearance. Now, FDA is the American Food and Drug Administration, and they're responsible for regulating medical diagnostic products. You need such a clearance in order to be able to sell a medical diagnostic product for use in the United States. And it happens that the FDA clearance, the United States clearance, is a deemed global standard. So everywhere in the world, it is respected that if you have an FDA clearance, then your system has been properly tested and really does what it says on the tin. Now, in our space, this liquid biopsy space, the idea of getting cancer material from blood for analysis, there is no FDA cleared platform at all for harvesting cancer cells for subsequent analysis. We're hoping to be the first one, and we've been working towards that now for over 4 years. We had a very important pre-submission meeting with the FDA in January, and as a result of that, we're in the preparation of an FDA de novo submission, and we're hoping to get an FDA clearance later in this year. Obviously, it's dependent entirely on FDA review and clearance procedures, but we've done a tremendous amount of work involved in that. We've run over 10,000 samples through our system as part of our trial work to do that. And in the other area, I mentioned that we had two areas that we were progressing proactively, brain and ovarian. And in ovarian cancer, we've already completed 200-patient studies to demonstrate the performance of our system in detecting ovarian cancer. And we've got a third and a clinical verification study, which is in progress, being run in the United States by the University of Rochester Wilmot Cancer Center, of 200 patients who are undiagnosed for ovarian cancer but have got an abnormal pelvic mass that needs surgery. That study is due to report in the middle of this year, and we're hopeful that we'll be able to offer that as a ovarian cancer test by the end of 2020. So we've got a tremendous amount of active progress going on in Angle right now.
Yeah, absolutely. And you had some significant news out on Tuesday. Can you explain the significance of this brain metastasis you released, please?
Yes. So we already sell the Parsortix system for research use, and we've got some of the absolute top researchers, cancer researchers in the world, are using our Parsortix system for investigative work. And in fact, one of the key opinion leaders in Europe, which is the Hamburg Eppendorf University, they're world renowned for their cancer research, and particularly in the field of liquid biopsy. They're a customer, and they've been using our system to do various analyses. And one of them is some breakthrough work that they've just had in a peer-reviewed publication. And this showed that there was a protein on the circulating tumour cells, the cancer cells that are captured with Parsortix, which but essentially it's the same, it's called ALCAM, it's the same protein that is found on brain metastasis cells in lung cancer. So lung cancer, unfortunately, is a very dangerous disease, and it's got a high mortality rate. And many patients die from brain metastasis, which means the spread of the cancer into the brain. And of course, if you want to do a biopsy to investigate how to treat those patients, you can't do it if you're talking about a brain metastasis, because cutting into a patient brain is obviously extremely dangerous. And it would be much, much better if you could find a liquid biopsy alternative. And in a nutshell, that's what Hamburg Eppendorf announced, is that with the Parsortix system, they could get hold of circulating tumour cells out of the patient blood just by a simple blood test, and they could find out the same information that they want to look for with a brain biopsy just from this simple blood test. So hopefully this will unlock the potential to improve the treatment of these cancer patients. So it was a world first, because nobody else had demonstrated this capability before, and it opens up yet another opportunity for the Parsortix system in the future. In this case, the work was done in lung cancer. It's quite a substantial study. 143 primary tumours and brain metastasis were studied in this work. They did the work in lung, but they've also noted that the same thing applies to multiple other cancer types that can spread into brain metastasis. So we're excited by that, and it opens up yet more opportunities for our Parsortix system.
Yeah, now I couldn't have you on in this time, in this day and age, without asking you about the coronavirus. It seems everyone has been affected in some way or other. Have you seen any effects from it?
Well, at the top level, obviously our work is involved in the treatment of cancer, and it's not obviously not at all related to coronavirus. And regardless of what happens with coronavirus, there is a very strong global need for our product. But obviously there are a number of impacts that we need to be wary of. At the moment, we don't have a problem with too many of our staff going sick, but obviously that could be a risk. We have seen two major cancer conferences have just been cancelled. The SGO conference, which is a big gynae oncology conference, and the AACR, which is arguably the largest cancer research conference in the world, has also just been cancelled last night. and we had a number of presentations at that. So obviously it's disappointing that these aspects happen. The most important thing, however, is obviously the impact on financial markets.
Yeah.
And I'm very pleased to say that Angle has a very strong cash position. We raised quite a lot of capital and have got very supportive investors. And we currently have cash to support the business right the way through to the summer of 2021. So we have plenty of resources to ride out the storm if indeed it turns into a storm. At the moment, of course, it isn't. So we're keeping a watchful eye on it. But we've got a lot of priorities to deliver in terms of our own business, and that's where we're really focused.
Yeah, absolutely. Marvellous stuff. Okay, well, Andrew, if someone's listening right now likes the sound of the progress you're making there at Angle, but are not yet following the story, give them 3 quick reasons why they should hit the follow button on your page on Vox and add you to their watch list, please.
Every patient's cancer is different and it changes over time. It's essential to try and provide information on the current status of cancer. That is not currently possible. Our Parsortix liquid biopsy will enable that and has therefore global application in every type of cancer and has the potential to transform cancer care in the future. That's the first thing. The second thing is that to get such a product adopted, you need regulatory clearance. We're on track to be the first ever FDA-cleared platform. In the first case, that will be in breast cancer, but we tend to expand it into other cancer types in the future. And that's on track for FDA clearance by the end of the year, all going well. And the third thing is, although the liquid biopsy market has been estimated by many parties to be a very, very large-scale market for the future, for example, Frost & Sullivan believe the market we're addressing will be worth $100 billion per year, so that's every year, and that's just in the United States. Despite that, the competition is primarily focused on a service-based approach. So, in other words, they can get blood tests and they can run them in a lab. But what they don't have is a product which can be sold to hospitals around the world, and that's what's needed, and that's what Angle offers. Those are my 3 points for you.
Excellent. Andrew, good to chat to you, and hopefully we'll catch up in the not-too-distant future. Thanks very much.
That was a pleasure, Justin. Thank you.
The VOX Markets Podcast with Justin Waite. Nothing in this podcast is intended as investment advice, and the people in this podcast may hold positions in the stocks they talk about. Do not buy anything based solely on a tip or recommendation. Please do your own research.